And good afternoon, everybody. Once again, it is Friday, 12 o'clock. It's time for our Lunch and Learn session. Today, we are joined by Bob Cooper, a coach, mentor, and a friend who has really had an impact on establishing an organizational huddle. I've had the joy of reading his book and having several chats. There's a lot of real good information. So I hope you can join today in the talk over the next 20, 25 minutes to get some insight on how to actually set it up and how to drive success in your organization. So Bob, again, thank you very much for joining us today. Look forward to your talk, and you can take it over from here. It's all yours.
My pleasure. Thank you, Walter, and I'm pleased to be with you. So the organizational huddle model is a model I developed back really in the late 90s when I was the director of organizational development at St. Joseph's Regional Medical Center just before going into private practice in 2002. And why did I develop it? I developed it because I was looking for a model that can be implemented easily within an organization to build excellent relationships between nursing up on a patient care unit and all of the other departments that support nursing. So I will discuss with you the background to how this all came about, the structure, and how you can implement it. So let's start off with the definition. It's based on the new sciences, which I will explain in a moment. It's a solution-focused circle of representatives from different departments dedicated to making positive changes in very short time frames. Most huddles are done in 10 to 15 minutes. It also improves interdisciplinary teamwork and patient or resident care. I also work both in acute care and long-term care. Now, in developing the model, I did a lot of research. And I looked at the new sciences, which is quite fascinating. It's a way to look at how organizational systems function in a way that actually fosters good interdisciplinary collaboration. And that's as opposed to Newtonian management. Most organizations, or many organizations, are focused on Newtonian management, which is based on certainty, predictability. They're hierarchical. They divide labor up. It's often driven top down. And often it's a competitive environment. Even when people don't realize it, they'll have Department A and Department B competing for the same resources. And oftentimes employees feel like they're passive units of production. Now, in the new sciences, which the organizational huddle is based on how do we manage uncertainty and constant change. And as we all know in healthcare, things are constantly changing. It's also based on non-hierarchical networks. In my model, once you roll this out, titles really don't matter. What matters is that we have representatives from each of those identified departments who are there to serve their internal customers. And thus, as opposed to a divisional label, it's very integrated, and it's an empowerment process. It's bottom up. And it's based not on competition, it's based on cooperation, and employees, in fact, become co-creative partners. So this diagram helps to further understand this. Newtonian management, which often is how organizations function, you have Department A, let's say that's nursing. Department B, let's say, for example, is the laboratory. Department C is central supply. Well, they're all well-intentioned, but we're operating under an assumption that if Department A, Department B, and Department C all do what they're supposed to do according to their job descriptions and their goals, then we're going to be successful. However, what this diagram also is there to depict, the Newtonian management, is silos. In other words, although people might be well-intentioned, things could fall through the cracks. Now let's look at the new sciences, which is based on how do we manage organizational systems based on unpredictability. It's based on quantum physics, which says organizations are live systems and they're very diverse and things are moving very rapidly. Well, as you can see here, Department A, let's say nursing, B, central supply, C, laboratory, for example. And I could extend it out to include many other departments. Well, as you can see by this, there's an interdependency. And symbolically, when implemented well, things don't fall through the cracks. And I'll elaborate more on this diagram as we go on. So what are the benefits and focus of my organizational huddle model? Teamwork. In designing this model, I was looking for a way to do this so that we do, in fact, foster good interdepartmental and interdisciplinary collaboration. Speed. Healthcare is moving fast. We got a lot of busy people. Things are happening so quickly. We've got to create a cadence of speed and a cadence of accountability. Now, think about the term huddle, which comes to the metaphor from football. Well, my vision when I thought about this, and I was mapping this out, I thought about a football team standing there looking at each other and be able to communicate in a very open, transparent way. Now, what happens often in the Newtonian model is we get overly dependent on emails and assumptions. The idea behind this model is to take all of those assumptions off the table. So what are the benefits? Very quick problem solving. What the Nursing Executive Center of the Advisory Board Company found when they evaluated this as a grade A best practice, one of the things they identified is that through this transparent communication and accountability, that it prevented problems from escalating, develops outstanding interdisciplinary collaboration, and it does, in fact, drive accountability throughout the organizational culture. And as I go through the structure in a few minutes, you'll get a better understanding of how it drives the accountability. Creates a highly engaged workforce, and it does, in fact, promote excellent and highly effective communication throughout the organization. This has been used by organizations in magnet status and the Baldrige Award for three, and it addresses three Baldrige quality criteria. It's patient-focused, it's agile, and it has a systems perspective. So let me go through some of the elements. The first element, no predetermined agenda, which is quite interesting because when you think of Newtonian management, right? And most of us as practitioners, we're taught you can't have a meeting without an agenda. But paradoxically, the magic, and I mean this sincerely, that's when I use the word magic, it's kind of part of what makes the organizational huddle work and why so many clients have had so much success is this is what we're teaching people. You go up on a unit, let's say med-surg unit, and you have and nursing's identified 4, 5, 6 departments that they rely on a regular basis to support them. And we set it up where those departments know on given days and times, let's say 8:30, Monday through Thursday, you come there, there's no agenda other than this. You are going to listen to your nurses, the nursing department, and they're going to share with you anything they need from you in that moment. We're not relying on email. We're not relying on assumptions. We're dealing in a very open, transparent way under the guidance of a huddle champion, which I will describe in a moment. Fast. Again, 10 to 15 minutes, you should have that cadence of speed and accountability. What part of when I've done this with clients, I have a very comprehensive organizational huddle champion manual. They go through a training on how to organize this, how to keep the tracking document, which I'll elaborate on in a moment, how to foster the collaboration based on mutual respect and based on the ensemble concept. Ensemble comes from music, a unit or group of complementary parts contributing to a single effect. In this case, relative using that metaphor, the single effect is serving the nurse at the bedside, serving that unit, right? And ultimately enhancing the patient experience. It's two-dimensional. In its design, it's meant to be both task and relationship. What I mean by that is we solve problems quickly, we prevent problems, but interestingly enough, and I've seen this evolve over time, through that face-to-face interdisciplinary collaboration with the guidance of a trained champion or champions, you build nice relationships. And I think all of us would agree as professionals that when you have relationships Based on transparent communication and mutual respect, good things happen. All participants involved, and basically it's based on the concept of representation, which means even though I usually start it like at a supervisory level, the theory being I need to get supervisors to learn how to collaborate well with each other. Then they could bring in staff and mentor them to do the same. It's an informal structure setting, which simply means you don't need to necessarily even book a conference room. I've had units where they'll take people into a corner and they'll just, to huddle up and find a section on that unit. You do it standing up and it's quick. All participants are involved. Again, participants could rotate. Unlike meetings, this is the beauty of this model. You can tap anyone on the shoulder. Let's just say, for example, we'll talk about, so a representative from Central Supply. It could be different representatives. All you're coaching them on is when you go to that unit-based huddle, you're there to represent us in support of your internal customer. Listen carefully, respond, you're empowered to respond, and then bring back what you learned. And high engagement. So a couple of huddle stories, just as over the years in implementing this in many organizations. I've had a CEO, even when he was rounding, dropped into a huddle on a unit. And happened to be an environmental services aide who asked him a question. And it's very natural, by the way, because one thing that even senior leadership learned is when you join the huddle, you're a member of the team. You're actually there to support your internal customers. A lab tech had an issue, something about they needed from there. This is the concept of we're customers of each other. So in order for the lab to help nursing had to do something for the laboratory in terms of how they mark some of the specimens. Critical care nurse up on the unit, the director of materials management was able to talk specifically about adjustments that he and his team were going to do to certain par levels. Respiratory therapist collaborated with the security director. The security director had some concerns, and that was all resolved. I'm just trying to give you some examples to show it's a very dynamic process, it's a very inclusive process. So what are the roles and responsibilities to make this thing work? Well, first of all, senior management support in this regard. So if you want to start an organizational huddle, you can manage up, but we need senior management to see, because here's the thing. When you have a unit-based huddle and it's, let's say, nursing, central supply, laboratory, radiology, environmental services, and there could be other departments as well, of course. I usually turn to nursing and say, what departments do you rely on most often on a regular basis and you'd like to be part of it? But then we need the senior leaders over those departments to buy into the concept and then say to their directors, look, I expect you to come to the training and I expect you to always have representation at the huddles and I'm going to hold you accountable. Very important. Now the champions, what do? They facilitate the huddles. Now let me go a little more into depth about how I organize this. They're also responsible, by the way, for tracking progress on a tracking document that they get as part of the training. So here's what happens. I usually recommend when we start on a unit, we select 2 to 3 people from that unit. It oftentimes is a charge nurse. It might be an educator, but it's usually 2 or 3 professionals who serve as the champions. Why? Now, let me give you the thought process that I used in why I selected champions to be from that unit. It's because since nursing is being held accountable to all of the outcomes in the patient experience, let's say with Press Ganey or other measures, I wanted them to feel kind of like an ownership. Now, but when I often do the organizational huddle champion training, I also will invite representatives from the other departments so that they get the education as well. Participants, they're accountable for showing up on time as a representative of their area and serve their internal customers. And so in that regard, think of it this way. We build trust. We say to our staff, when you go to represent us at that huddle, I'm empowering you, I'm mentoring you, and I'm trusting you that you're going to serve that internal customer. Worst thing that happens if I overcommitted, right? If I overcommitted, worst case scenario, you as the supervisor, let's say, you could reach out to the huddle champion and say, hey, Bob Cooper, he made a commitment that we're really quite not able to fulfill, but let's talk about what we can do. But remember also, as I help kind of map this out for you, what this is all about. We're avoiding the need for all these different in departments to have to receive emails and all this other stuff. And one other thing I want to mention also, what I have found in this model is people learn and grow together. Because as we're sharing information with each other, both in terms of problem solving, and one of the elements of this, and I'll go through in a moment, but I'll mention it now, is you also provide updates to Huddle. For example, I'm from the pharmacy. I'm representing pharmacy, and I say, by the way, just want to give you a heads up. We're going to be changing something next week. Now, some people might say, but Bob, isn't that going to come out in an email or some other correspondence? Yes, but think of it this way. If it comes out today at our Huddle, right? A, I'm able to communicate directly with you. B, we don't have to worry about somebody misinterpreting the email. C, it allows for two-way communication. So we're fostering a culture of openness, inclusivity, and transparency. Now, let's talk about how you could actually implement this. Well, what the process is. Let's say we have a unit, med-surg Huddle, and it's been determined by the champions with the support of all the identified departments that are to be represented. Also, again, as I mentioned earlier, the support of senior leadership so that we know everybody's on the same page with this. If we've decided that we're going to meet in a certain area on that unit at 8:30 Monday and Thursday, you show up, you get up, you stand in a circle, the champion starts the huddle on time and is making a note of any departments that are missing. Now, some people might say, but why do we do that? Here's why. If we're going to make this model really take hold in the culture of the organization, there are two things that must happen. And I mean must happen. A representative must be there on time, and they must serve their internal customer. Now, some people say, but Bob, people get busy. I go, but remember what I'm saying here. Hey, you could slot anyone in to represent you. That's the beauty of this. Think about a football team. Player gets hurt, another player comes on the field. Unlike a standing committee where they go, Bob Cooper can't show up today, so we can't meet. I've had that happen in my career. This is a dynamic process based on the concept of representative and serving your customer. Now, here's what happens when a champion is facilitating it. In rotation, the champion will turn to, say, the nursing representative and say, okay, what do you need from any of these internal suppliers? You allow them to be, but they have to be very specific. If anything, then the internal supplier, whether it's central supply, pharmacy, lab, or any other department, they then respond. So an example could be, we say it's a request to central supply. We would like to increase our par levels to ensure that we have our med carts on these two stock items. Could you go from 25 to 50 starting this Friday? The person with central supply might say, and most of the times this is what happens, no problem, consider it done. The champion will write that down as a commitment. Sometimes you can't give the nursing exactly what they're asking for, but you know what? We can then negotiate. And this is what the champions are trained on, how to foster good communication and collaboration and negotiation. Now, I want to talk for a moment about problem prevention. The other element that the champions are asking everyone at the huddle, okay, after you go through any issues, meaning anything you need resolved and supported, you then go around and ask any updates. And an update simply is anything going on in your area that you believe it would be beneficial for your internal customers to be made aware of. That, my friends, is problem prevention. We're not waiting for anyone to read the next email that's coming out. Don't get me wrong, you could still send the email, but this now gets the communication out in real time. And I can tell you, and by the way, I want to say one of the dynamic about this. I want to go back to Newtonian management. In Newtonian management, here's what would happen. Nursing would reach out to, let's say, the laboratory and say, oh, I need this. right? Or the laboratory would provide an update to nursing. And it would be just between the laboratory and nursing. But think of what happens in the organizational huddle. Laboratory is giving an update which is geared towards nursing. And then suddenly, Department C off to the side, radiology says, hey, I'm impacted by that as well. And it's a dynamic process. I must tell you, from playing the role of champion when I first rolled this out and being in the trenches, I can tell you that many, many times when that update's being provided, where it appears to be just between two departments, other departments say, wow, I'm impacted by that as well. It's quite fascinating. And that helps to prevent problems from escalating. And that's part of what I said earlier about the new sciences. Organizations are very dynamic. And it's kind of like we think we know the whole game plan, but sometimes we don't know until we get there. And it's through this transparent communication in an organized way, under the guidance of a trained champion, that things evolve that we didn't even know. And I'll tell you what's interesting. I've gotten this feedback from many clients. Staff often find it fascinating. They learn a lot about the organization and about the moving parts. So it's really interesting from that growth in terms of staff growth and development. So what does the champion do? They ensure that all concerns that are addressed, commitments to resolve as requested. They work on negotiated solutions. Now, in some cases, this is what happens. I follow a 2-minute rule, which is a metaphor from football, like 2-minute warning, right? Like half. Yeah. So here's what happens. As two departments like nursing, let's say, is working on a negotiation with the pharmacy, let's say, under the guidance of the champion, sometimes what we find is that it's too big of an issue to solve within a couple minutes. So what will the champion often do? They will get agreement to move this offline to a separate meeting. And they note that on the tracking document. And I want you to think of it this way, that in that regard, the organizational huddle model is a triage process. Like it goes through a funnel. Most problems are the lower hanging fruit that get resolved, right? And we keep each other updated. But occasionally what emerges is a problem that's a systemic problem that goes way beyond the quick fix. And that's totally okay, because that could be triaged. Maybe it's something that's going to then become part of Six Sigma and have to do a complete process review. But there, in that regard, that's the relationship between the organizational huddle, right, and a process improvement initiative. But that's okay. It was identified at the huddle and it was moved offline, but it's still noted on the tracking document. Champions meet with senior management. I strongly suggest to all my clients that the champions, and often what will happen is you'll have huddles on every unit. So all representative champions go, and maybe they'll report out to like a patient satisfaction committee or perhaps even an operations committee. And what they're reporting out on basically are two things. Is how's the progress of the huddle? What kinds of things are they resolving? And also a qualitative review, meaning what are they seeing in terms of staff development? What are they seeing in terms of interdisciplinary collaboration? What are they seeing in terms of problem prevention? And I can tell you, I've had clients tell me that during Joint Commission review, because they've had a very mature huddle, they would say at the review to Joint Commission, when Joint Commission would ask certain questions about interdisciplinary collaboration and problem solving, they'd say our organizational huddle helps resolve that. But it is good to have a governing body. So just some examples, this is included in my book, Huddle Up, a regional medical center in New Jersey. These were the overall objectives. Quickly resolve problems and prevent them from escalating, drive down decision-making to those closest to the customer, develop outstanding interdisciplinary teams. And it was also, again, the focus on enhancing internal and external customer satisfaction. The outcomes, I don't know, it could be up to 5,000 by now. This is old, but there were over 1,000 problems quickly resolved to date. They had strong teams, highly engaged and accountable workforce. They did find an increase in patient satisfaction scores, and they did expand it to another one of their hospitals. Health system in New York, objectives very similar to the previous slide. quickly resolve minor operational problems before they reach crisis level. That was it. These are objectives they identified. Develop interdisciplinary collaboration across multiple departments, enhance internal, external customer satisfaction. At that time, there's over 400 problems resolved. Strong interdisciplinary teams, again, increase in patient and staff satisfaction. They also linked it to staff satisfaction. Enhanced accountability, and that's key. It expanded to other hospital sites, and it was an interdepartmental. And the last example is Connecticut, hospital in Connecticut. They were very focused on developing strong interdisciplinary teamwork within the critical care division and enhance staff satisfaction. And they did find a significant increase in staff satisfaction within critical care. And they found that they, in fact, did build accountability and teamwork. And these were interdisciplinary within critical care. In addition to these examples, it's been successfully implemented in several other healthcare facilities and a manufacturing company as well. Implementation strategy, executive overview, champion selection. So again, it's usually picking a couple, maybe one or two pilot units to do this at. Work with nursing to figure out who are the internal departments they most rely on a regular basis, getting the support from those departments and their bosses. Now, participant training, that's usually the way that gets rolled in is we'll just invite people to come to champion training. It makes more sense. And then the people that come to the champion training, they become mentors for other staff who they bring and mentor be participants. Conduct the pilot huddle, keep the tracking document, monitor outcomes, and then the process expand. Any questions? I know I kind of went through, in respect for your time, I tried to move fairly quickly.
Bob, thank you very, very much. I think that we'll open it up for a question in a second. So I have had the fortune of being a participant in highly successful huddles and those who lacked true value. The reason why I asked Bob today to provide this talk is to really kind of show you that there's a structure to it, right? And there's a growing component to it. In the academy, we talk about your individual personal scorecard. So that's the huddle you do with yourself on a daily basis. The next is we want to start having a huddle with your team that is interdepartmental. And as you start growing that competency and you get a feeling of what it is that you're trying to accomplish, that's solving small problems, building collaboration, and be able to be a really good customer and provide good service, then you start broadening that out. Now, some of you are service providers, right? So you will become part of the huddle within a nursing department or in hospital itself. But the key thing here is that, to do this, it takes a certain level of discipline. And it requires on your part to be that servant leader, as we talk about so very often. So again, Bob, thank you very much for laying this out. I'm going to stop the recording and we'll take some questions.
Yeah, my pleasure. Thank you. And I'm happy to answer any questions you might have. If you need any clarification, I'm very happy to assist you.
Excellent.
I have a